Hello everyone, welcome to this video. Today, we will talk about autism spectrum disorder, commonly known as ASD. Autism is a neurodevelopmental condition that affects how a person communicates, interacts socially, behaves, and experiences the world. Autism is called a spectrum because it affects individuals in different ways and at different levels of severity. Some people with autism may live independently, while others may need lifelong support. Autism is not a disease, and it is not caused by bad parenting. It is a lifelong condition, and with early support and proper therapy, individuals with autism can lead meaningful and productive lives. In this video, we will discuss what autism spectrum disorder is, causes and risk factors, common signs and symptoms show autism is diagnosed, treatment and management options. Let's begin. What is autism spectrum disorder? Autism spectrum disorder is a neurodevelopmental disorder, meaning it affects the development of the brain. ASD mainly impacts social interaction, camarabionic, and interest. Autism usually appears in early childhood, often before the age of 3 years, although some signs may appear earlier. The term spectrum means that symptoms can range from mild to severe. Each individual with autism is unique. No two people with autism are exactly the same. Some individuals may have strong language and intelligence development with social skills. Others may have limited speech, intellectual disability.
Causes and risk factors of autism. There is no single known cause of autism spectrum disorder. Research shows that autism develops due to a combination of genetic and environmental factors. 1. Genetic factors. Genetics play a major role in autism. Autism often runs in families. Certain genes can affect brain development. If one child has autism, the risk is slightly higher for siblings. However, no single gene causes autism. It is usually the result of multiple genetic changes. 2. Brain development differences. Studies show that people with autism have differences in brain structure and function, especially in areas related to communication, social behavior, emotional regulation. These differences occur before birth. 3. Environmental risk factors. Some environmental factors may increase the risk, especially during pregnancy, such as advanced parental age, complications during pregnancy or birth, premature birth, low birth weight. 4. What does not cause autism? It is very important to clarify that vaccines do not cause autism. Autism is not caused by parenting style. Autism is not contagious.
Signs and symptoms of autism. Symptoms of autism usually appear in early childhood, but they may vary widely. The symptoms are generally grouped into 3 main areas. 1. Social interaction difficulties. People with autism may avoid eye contact, prefer to be alone, have difficulty understanding social quest, struggle with making friends, not respond to their name, appear unaware of others' emotion. Children may not point to objects to show interest, share enjoyment with others. 2. Communication challenges. Communic difficulties may include delayed speech, development of speech at all in some cases, repeating words or phrases, echolalia, difficulty starting or continuing conversations, using unusual tone or rhythm of speech. Some individuals may communicate better through gestures or picture as understood language but struggle to express themselves. 3. Repetitive behaviors and restricted interest. Common behaviors include hand flapping, rocking, or spinning, repeating the same actions, or rudeness, strong attachment to routines, distress over small changes. Restricted interests may include intense focus on specific topics, lining up toys instead of playing with theme, obsession with numbers, shapes, or objects. 4. Sensory sensitivities. Many people with autism experience sensory issues, such as sensitivity to loud sounds, discomfort with bright light, strong reaction to textures, smells, or tastes, avoiding physical touch or seeking it excessively. Diagnosis of autism. There is no blood test or medical scan that can diagnose autism. Autism is diagnosed through behavioral observation, develop assessment to diagnose autism. Diagnosis is usually made by pediatrician, child psychologist, specialist. Show diagnosis is donate, doctors evaluate communication skills, social interaction. Behavior patterns. Developmental history. Parents and caregivers play an important role by sharing observations to spring the child's behavior. Early diagnosis is very important because it allows early intervention, which greatly improves outcomes. Treatment and management of autism. There is no cure for autism, but early intervention and therapy can significantly improve quality of life. Treatment is individualized based on the person's needs. 1. Behavioral therapy. Applied behavior analysis (ABA) is one of the most widely used therapies. It helps improve communication, reduce harmful behaviors, teach daily living skills. Treatment and management of autism. There is no cure for autism, but early intervention and therapy can significantly improve quality of life. Treatment is individualized based on the person's needs. 1. Behavioral therapy. Applied behavior analysis (ABA) is one of the most widely used therapies. It helps improve communication, reduce harmful behaviors, teach daily living skills. 2. Speech and language therapy. This helps individuals improve verbal communication, learn nonverbal communication, develop conversation skills. 3. Occupational therapy. Occupational therapy focuses on daily living skills, motor coordination, sensory integration, and attendant. 4. Educational support. Special education programs provide individualized learning plan, structured environment, skill-based teaching. 5. Medications. When needed. There is no medicine to treat autism itself, but medications may help manage problems. These medications must always be prescribed by a doctor. 6. Family support and counseling. Family education and counseling are essential to understand autism, learn coping strategies, provide emotional support. Living with autism and awareness. People with autism can learn, work, build relationships, live fulfilling lives with acceptance, understanding, and support. Society can help individuals with autism reach their full potential. Autism awareness helps reduce stigma and promotes inclusion. To summarize, autism spectrum disorder is a lifelong neurodevelopmental condition. It affects communication, behavior, and social interaction. Causes include genetic and environmental factors. Early diagnosis and intervention are key. Therapy, education, and family support greatly improve outcomes. Thank you for watching. If you found this video helpful, please like, share, and subscribe to spread awareness about autism spectrum disorder.